here with Gary, and we're just about to start his procedure. Gary's a Norwood 5, missing most of the hair in the frontal and mid-scalp, and I've drawn out the hairline, and as you can see, it's an irregular, jagged line, and you'll see it more clearly once the grafts go in. And what we're basically going to be doing is looking to fill the entire frontal and mid-scalp with about 2,500 or so grafts. Completed the procedure, and there's Vaseline on the grafts. As you can see, that's what that clear stuff is. It keeps the grafts moist. And you can see the density in the irregular hairline, which will make it look completely natural with some stray native hairs in front of the hairline. And then you can also see just basically the amount of grafts. We did, I believe, just under 2,900. I think it was 2,886. Really short, and as you can see, he did it down to like a number 3, and even we just sutured it up a few hours ago, and the hair covers up the suture line almost completely. Very hard to see, even wet. I'm with Gary. We just finished his first hair transplant procedure, just under 2,900 grafts. Tell us how the experience was for you.
It was quite enjoyable, actually. I was comfortable, watching movies, and didn't feel much of any pain after the numbing. And everything was professional, and I had no problems at all.
Fantastic procedure on Gary, and you can see the irregularity in the hairline. And some of the grafts have already fallen out, but probably about 75% of them are still there, and you can see the density created. And when you get in really close, you can kind of see the grafts that are left there. But again, a bunch of the grafts in the middle have already fallen out, and they will all fall out, or most of them fall out within the next 3 to 4 weeks, and they will start to regrow at about 12 weeks, and we should see about half the growth at 6 months and the remainder at a year. We're roughly 2 weeks after his first hair transplant procedure. Tell us a little bit about the experience, what it was like, and how you feel now.
It wasn't too bad. The recovery was pretty good. The first night was a little difficult sleeping because of I sleep with my head on the side of the pillow. But other than that, you know, the rest of it, you know, started solidifying and drying out a little bit. It wasn't so bad. And I just followed the directions and shampooed it properly every day, not touching it, just pouring it over, and eventually started shampooing it gently. And the scab on the back is healing good, you know, the scar. And I'm looking forward to seeing the final outcome.
Fantastic. Well, we look forward to an update.
Thank you.